In this video, we'll learn about tonometry. What is tonometry? How do you perform tonometry in objectively and in a clinical case presentation without any instruments? And what is the importance of knowing the intraocular pressure? So tonometry is nothing but measurement of the intraocular pressure. So the eye as the globe has a pressure. So normal intraocular pressure is 10 to 21 millimeters of mercury. If it is raised, if the intraocular pressure is more than 21, we call it as glaucoma. The questions might be, what are the types of glaucoma? You can either say primary or secondary. Where primary, there's a no reason, and secondary, there's a cause. Okay. Open angle or closed angle, depending upon whether the angle is open or closed. We'll learn about these in another video. Here we'll concentrate on the clinical skills. Reduced IOP, less than 10 millimeters of mercury, is called as ocular hypotony. So what are the causes of ocular hypotony? Ruptured globe, phthisis bulbi, choroidal detachment or retinal detachment, iridocyclitis, postoperative only, post-cataract surgery or post-trabeculectomy, and ciliary body shutdown. Now, how do you measure the intraocular pressure? In a clinical case presentation, especially for UGs, you're not expected to do no objective way of measuring tonometry, but you are expected to know the digital tonometry, where we can only say whether it's normal, whether it's raised, or it is low. For this, we perform what is called as digital tonometry. So you ask the patient to look down and then perform a fluctuation test with the two index fingers. You press with one finger and you feel the firmness with the other finger. It's very important that you ask the patient to look down, identify the upper lid crease, and do the fluctuation test above it. So, what is the important thing? You're asking the patient to look down because you want to do the fluctuation test above the tarsal plate, because the tarsal plate is firm and you cannot do a fluctuation test through the tarsal plate. So once the patient looks down, you can do the fluctuation test on the sclera, which is lying now above the tarsal plate. You will not ask the patient to close his eyes, because what happens when the patient closes his eyes, the eyeball moves up, which is the normal Bell's phenomenon, and you don't want to do fluctuation test on the cornea. You want to do the fluctuation test on the sclera. So for that, the best way is to ask the patient to look down and perform the test above the tarsal plate. Okay, so it's very important to do it in this manner, because if you're doing the fluctuation test on the tarsal plate, then you will get wrong impression. So once you do this procedure, how will you present it? On digital tonometry, the globe, I felt the globe to be firm, so the pressure is, intraocular pressure appears to be normal. If it is hard, you'll say if it appears to be hard, so probably intraocular pressure is high. I would want to confirm it on tonometry. Or if it is soft, you'll say appears to be soft, so I would want to confirm it on tonometry. Please remember, just by doing digital tonometry, you will not be able to say what is the exact intraocular pressure. For that, you have to do tonometry, which are using the instruments, right? So what is tonometry? It measurement objective method of measuring the intraocular pressure. It can be indirect or direct. Direct is not usually done because it's invasive. We put a needle into the globe and measure the intraocular pressure. Whereas indirect, there are two types: indentation and applanation. Indentation method, the instrument uses a Shear's indentation tonometer, which is not commonly used now, but can still be found in peripheries or in camps. Whereas applanation tonometer is the most commonly performed procedure. In that, we have something called as contact and non-contact. In the contact method, we have the Goldman's, which is the gold standard for measuring the intraocular pressure, and it is attached to the slit lamp. Whereas Perkins is also an applanation tonometer, but it is a handheld tonometer which you can use. You can carry it around, use it in either OPD or wards, ICU. You can use the handheld Perkins applanation tonometer. The non-contact methods, the air puff or the pulse air methods, these are used for screening. When you have large number of patients and you want to screen them for glaucoma, these are commonly used. So Using a tonometry, you will come to you will get to know the exact intraocular pressure. And again, the question will be, what is the gold standard? Remember, gold standard, Goldman's applanation tonometer is the gold standard for measuring intraocular pressure, and all the other instruments are actually compared with Goldman to validate it. Now, the second question, there can be a question of why you want to measure the intraocular pressure in a cataract case. If you're given a cataract case, why do you want to measure the intraocular pressure? So please remember, one, cataract and primary open angle glaucoma will present in the same way as gradually progressive loss of vision. So during examination, once you've done all the examination, you want to rule out if the pressure is raised, so you would do tonometry to rule out primary open angle glaucoma. So to narrow down on your differential diagnosis. Second thing, if you've identified as cataract and you want a preoperative investigation, also you'll do tonometry to measure the intraocular pressure. Question is why? If the pressure is very high and you cannot do um, cataract surgery, you have to reduce the pressure by using anti-glaucoma medication and only then perform the cataract surgery. So what is the complication that can occur when you do cataract surgery in raised intraocular pressure? It is usually expulsive choroidal hemorrhage. So these are the questions that can be asked during your case presentation. Thank you very much.